Welcome to Ayush Samriddhi 197 national webinar. Definitely it is international due to the presence of our speakers, Dr. Ajay Kumar T. As we know, this journey has reached now the milestone of 197th webinar with your valuable supports, valuable blessings, and in association with Vishwa Ayurved Parshad, Ayush Darpan Foundation, and definitely, first and foremost, my organization, Imami and Jandu. So I would like to welcome you all again. Today is World Photography Day. It's very unique day. I would like to communicate my sincere thanks and regards for accepting our proposal within very short period. Swagatam, Swagatam, Namaskaram.
Namaste and welcome all to 197 Ayush Samriddhi National Webinar. Today, 19th of August is World Photography Day and we are to celebrate Ayurveda, rare and best photography. On this day, with support of Independent Research Ethics Society, Vishwa Ayurved Parishad, Ayush Darpan, Jandu Imami, we are having three special speakers from different parts of India. So, as World Photography Day, photography is one of the most interesting thing, and we'll be excited to know how we can have rare and best photography with our Ayurveda. We have with us one of the special sir with us, Dr. Ajay Kumar T. Sir. Sir is a consultant psychiatrist. He is the director of Punyakoti Health Services HOSPETE. Sir is a very well-known figure and sir is a very well-known practitioner in mental health and sir will be discussing with us Kirlian photography in clinical practice where photography for mental health, and we are indeed blessed to have Ajay Kumar sir with us and we are excited to know more about Kirlian photography. Sir, you're welcome.
My pranams to all the Ayurvedic fraternity and the other people who have gathered here for this webinar. It's indeed a privilege for me to be among all of you and to share my clinical experience. Thank you. Now, it's indeed a privilege to be on this dais to interact and to share my clinical experience as a psychiatrist, as a practicing psychiatrist with my other Ayurvedic colleagues. It's indeed a privilege. And today's topic has been a rare and best photography. My main objective of this next 20 to 30 minutes presentation would be to basically to reach an objective of how we can enrich our client-centered clinical practice through technology, that is through photography. Now, specifically today I'll be talking about the Kirlian photography. And I would be going in a particular flow chart. Initially, it will be an introduction as to, how we are practicing here and what is the need for photography in our clinical practice. And then the concept of health as a multi-dimension, very basics of, very basics of Kirlian photography, and about the device we are using here, bioval device and bioenergy, and our experience in clinical practice with this device. Both, I will be presenting few case studies and the pros and cons of it. Ultimately, the objective for the listeners would be that how can we enrich our client-centered clinical practice? I'm very specific here in saying that it is client-centered, not the doctor-centered. So once we say it's a client-centered, obviously our approach has to be multidimensional. Coming to our clinical practice here, so that a few points about the background, so that we'll be able to understand better. And we are practicing for the past 20 years, following what is called as an integrative or a holistic mental health practice. Through two things, one is the Punyakoti Healthcare, and then the Punyakoti Foundation, which is the charitable aspect of it. And we are a team. We do operate as a team here, holistic team. We are 4 psychiatrists, including myself, an Ayurvedic physician, an homeopath physician, clinical psychologist, medical social workers, nature therapists, and the allied staff. And we deliver these services through 2 centers. One is a 25-bedded hospital in a semi-urban area, and a 15 acres area where what we call it as a healing spaces, which is much more nearer to naturopathy and Ayurveda. We do deliver through two platforms. One is center-based services, the other is community-based. Now, our major, sort of a search or a research is something about an interface between spirituality and mental health. So, with that in a few backdrop, we go to the next part. Okay, this is a few photographs about our place here. That's the healing spaces. It's about a area wherein we are looking out how nature can cure mental illnesses. Okay, now coming to the next part about health as a multidimensional thing. Once we say it is a client-centered approach, obviously our first, the primary objective or the top on priority is to understand the client in a much better way or the best possible way so that we are able to give him the maximum inputs so that his health improves. Now, once we call it as a client-centered, obviously the next thing would be to look at it in a multidimensional way. Yes, the definition which is probably widely accepted by the WHO and elsewhere is about the multidimensional aspect of physical, mental, social, and spiritual domains of health rather than just merely an absence of a disease or an illness. As I shown here in this slide, our major concern is this spiritual aspect. We are given too much of importance to this physical aspect, especially I'm telling it in our MBBS background, the Western medicine. Now it's more of it is more towards this mental health and also social health with the COVID in background. Somewhere we are just still unable to touch that spiritual aspect. I'm talking in the context of Western medicine. Definitely Ayurveda and other alternative systems are much more ahead in terms of spiritual health. Now, once we say that I need to understand a client in my clinical practice, I basically want the data about him to the maximum extent or the information so that I can collate that information, analyze it and come to a diagnosis which helps me in making a management plan. Now we have different modalities of obtaining this data. One is history, a clinical history, which is given either by the patient or by the caretakers. Then we have a cross-sectional clinical examination. Then we have investigations, which will generate us some evidences as to show what is happening with the patient. These are the three areas wherein we try to collect our information so that we are able to understand the person in a multi-dimensional way. Once we say investigations, obviously it's objectivity, wherein I am showing an objective evidence to the patient that there is something something wrong with your health. Therefore, you need to get it corrected. So once we call it as an investigations, our next thing is uh, about documenting. Yes, we have this physical health. We know very well. Yes, we have a lot of documentation available, lot of investigations available. You name them, it is there. Starting from the blood investigations to the imaging or to the functional MRIs. We do have a lot of investigations where we can document so that I can get a lot of information about the physical aspects of the person. Now, coming to the psychological aspects, definitely it is less investigative than the physical aspects. But in the recent times, we do have some psychological tests which are delivered by these mental health practitioners, psychiatrists or psychologists, who we are able to understand something like a Rorschach test, which is a projection test, so that we can understand the processes happening inside the mind. Somewhere EEG comes nearer to that to rule out some organicity. Yes, that is another way of investigating the psychological health. Now, coming to social health, the other dimension is there are a lot of social determinants of health, wherein we are able to document them through surveys or through doing a lot of epidemiological studies, trying to understand what are the factors, social factors which determine the health. Now, the biggest challenge for us is spirituality, the spiritual health. I put a big question over there, and it's a big question. It's something which is probably a lot of debatable things to be done. But can we look at it as something which is energy? Nowadays, there is a big thing coming up called as an energy medicine. So, can we relate spirituality with energy? There are a lot of Oriental philosophical thoughts wherein they say spirituality is nothing but energy, which is not visible through our five senses, but which can be felt. Probably, which probably it's very difficult to vocalize it. So, can we look at it as an energy? Once we call it as an energy, can I get an data about that spiritual domain of my client? So I'm able to get a physical data. I'm able to get something related to psychological and social data. But when I look at the spiritual aspect, am I able to get some data related to this energy? If at all, if we agree, is whether energy is somewhere nearer to spirituality. Let's for the time being agree that energy is related to spirituality. Now, one thing which comes nearer to the documentation of energy is, Kirlian photography. What we are talking today about rare photography in clinical practice, one of it is probably Kirlian photography. Can we use it as an investigative tool so that I can generate evidences, I can generate some data about my client so that I'm able to understand him better. So what you are seeing is different Kirlian photographies. Now, once we say that, what is Kirlian photography and then what is the devices which we are utilizing here? What is our experience? Now, coming to the basics of Kirlian photography, I'll not be touching much of theory, but very basic so that we are able to understand it. And the common notion about Kirlian photography is something that we are seeing something which is invisible. I mean, somebody call it an aura or prabhavalis and all that stuff. But coming to the very basic science of photography or Kirlian photography is something which we are. It's a technique for creating a contact print photography. As you can see, the image I am showing here, it's a contact print photography. No lens are utilized here. When you pass a high voltage and a high frequency current momentarily in short pulses to the object over here, something like a plant leaf over here. Now, once that current is passed, there is a discharge of electrons and photons from that particular object. That we call it as a corona discharge. When the discharge is there, that needs to be captured onto something. And there is a plate here, what we call it as a photographic film. And there is a glass below that, and there is a metal conductive plate. So it completes the circuit. You pass a current onto the object. It discharges all the electrons, photons which are accumulated in the object. That when it discharges into the environment or outside, it creates something which is flashy or which has got light because it is photons. That we call it as a corona discharge. And now that particular light, that photograph is captured onto a particular film. This is called as a simple as a Kirlian photograph of an object. So please understand here the corona discharge. The electrons and photons which are already there in the object, they are stimulated and they are discharged. They produce some sort of a light phenomenon which is captured onto a light. Now, coming to the next part. Now, I mean, a lot of research has shown, I have mentioned here that most of, not all, any biological aspects, it can be plants, blood, human skin, do emit the photons, and it varies also based on the physiological state of the organism or the humans. So once we call it as a physiological state or the metabolic state of that organism, then obviously it depends on the internal state. The internal state which is again governed primarily by the CNS or the autonomic nervous system. Now, what I am showing here is just an artistic pictorial depiction. It is not the original photo. Probably what is seen here, these are the biophotons or the electrons which are emitted. Okay, now coming to this biovel camera. I'll be showing you this biovel camera here on my video. What you are seeing here is a small box, right? This is a biovel camera box. Now, this we have imported from, it's a Russian invention by name Dr. Korotkov, over 20 to 25 years of experience. They have designed this and patented this technology, gas discharge visualization, GDV technology, which is based on Kirlian photography. Now, this is that camera box. This is basically to photograph the fingers, all the 10 fingers. What you see here is an aperture. And after calibrating this machine, this is connected to the laptop which I am using now. All the data which is collected, once we place this finger here in this particular aperture, it's a dark chamber inside, has got a glass inside, and it gives a short brief pulse. When that brief pulse of high voltage, very low amperes, doesn't got any injury, we place each finger, all the 10 fingers are photographed through this, which is a simple click onto your laptop. That data, that film which is captured in this box, camera box, is fed into a software which is designed by this particular company, Biovel, and it gives an analysis. So this is the Biovel camera which we are utilizing. I don't call myself an expert because we just brought it around 3 to 6 months back, and I'm just still a learner and a student of it. I'm trying to share my experience, little bit of experience into what we have. And so what you are seeing on my PPT It's an analysis of the electrophotonic. Already I told you electrons and photons are emitted by our fingers now. And so that's what I have written here. Weak electric current is applied to the fingertips for less than a millisecond. Once you apply that high voltage and then high frequency, very low amperes of current, a brief pulse of current, all the photons and electrons are extracted from that finger. It creates an electron cloud that is captured onto a camera. Then it is fed into a software which gives us an analysis. So this is very briefly about that. Now, basically to say, this shows us what is the energy level of that particular person, totality, and also about the energy level in the each organs. Now, the next part, I mean, how are they able to analyze this just by taking a finger photographs? As per this Biovel company and with the evidences they have generated for the past 20 to 25 years, the fingers are connected to the different organs and systems. I mean, the Ayurvedic people know it very well through this Chinese traditional medicine. Based on this concept, in Germany, Dr. Wohl and Dr. Mandel, they have validated these things. And then Dr. Korotkov, who is the founder of this Biovel, has generated a lot of evidences to show that it is correlated very closely with the finger photographs to the organs and systems. Okay, that's what I have also again repeated here. So any changes in this particular photograph we take, that is the energy photograph, is an indicator of an abnormality of the internal system. That means of our body, the energy supply of the organs and the systems, which are again controlled by the autonomic nervous system and the central nervous system. Okay, this is the actual photograph you are seeing here. On the right side of your screen is the Biovel camera box, wherein the fingers are inserted in a particular way, in a particular procedures, and then it is connected to the laptop to a software. And then if you see on the screen over here, these are the actual photographs which are being taken. Now, the chakras, which are more closely related to Ayurvedic concepts, even the chakra analysis are being done here. And then this is the energy field parameters of the organs and systems. Okay. Now, I'm just going on to move to my clinical practice, how we are utilizing it with few case studies so that you are able to understand it better. As I told earlier, we are trying to collect the maximum data from the clientele so that we are able to treat him better. Now we are being, we are utilizing it at two levels. One is at the diagnostic level, the other is at the therapeutic level, right? Now, at the diagnostic level, obviously, when a patient comes to me saying that he has got a headache, now once I say he's come to me with an headache, then he gives a whole lot of information to me. I do the examinations and the investigations, but still it is incomplete. There are few things the person might not have told us. I'll show you some case studies later on wherein they have skipped telling us something which is major for us to diagnose, but we were able to pick it up onto this through this Biovel camera. That means to say it gives us an holistic view of the clientele, that is at the diagnostic level. Now, coming to the therapeutic level, say we are measuring the energy, as I told you earlier. Now, it gives an objective evidence of change. Whatever interventions I am doing, either it is through medications, through our allopathic practice, or it can be counseling, or it can be any Ayurvedic treatment, or it can be panchakarmas, meditation, or it can be nature work, or it can be simple, the dietary changes which we suggest, or the lifestyle modifications, any of the therapeutic interventions which are going to do, including music, these changes can be seen. That's how I'm going to show you next some case studies. So we are utilizing this Biovel device at two levels. One is at the diagnostic, at the therapeutic level. Now, I'm just going to show you a few case studies. I'm going to take another 10 minutes. Is it okay, so Dr. Jayesh? Now, yeah, I'll be just showing you across this the software analysis part. Okay. Now, I'll be showing you the exact photograph, how it is going to look. I think it is visible to everybody here. Now, this is the actual photograph. Now, what you see, this black line is the outline, the physical outline of our fingers. And what you see here is a glow. That means when you pass on a brief pulse of a current high voltage, very low ampere, when you pass it on, then there is a surge of electrons and photons away from the finger. And then that surge of electrons and photons creates a corona effect, and this is photograph. And if you can see these red vectors, I mean the lines are drawn, these are the different vectors. as per the Chinese traditional system, this each vector is again related to one of the fingers. For example, I am telling to you about the cortex. Now, this particular area of the finger is related to the cortex. That's how they are going to determine. So, this is the original photograph what we are seeing. Now, so this is all the sectors. Now, this is just a graphic representation of the photograph, but this is the original photograph. Okay. Now, we get back, and these are the 10 fingers what you are going to see, starting from the right thumb, that's on the top of your screen, that's the right hand, and then we have got the left hand. This is how we are going to photograph each finger and then see whether it is accurately done or not. Then we go to the analysis part. Now, please understand that biowell device, or what we are determining the energy level of the person, is not it's not a thing which is going to give you a diagnosis. It is just going to give us a picture, and it depends on our interpretation. Therefore, clinical correlation is very much of importance, because there are a lot of other factors which can alter these energy levels, and we can't go by the face value of it. We have to clinically correlate with our clinical impression with the clinical data we have already in hand. Therefore, please remember, these are not diagnostic. This is just going to give me a data so that I can understand my client better in a deeper way. So therefore, now we come to the analysis part. What you see here is a okay. Now I'm going to take one patient by name Aditya. Now, this is the energy field. I'll just glance across all the parameters and then we'll come to the case proper. Now, this is the energy field. Please remember, this is not an aura. This is a graphical representation of the data which has been collected, which is shown graphically, digitally over here on the screen. But it looks typically like an aura to us, but this is not the actual aura. Now, this is the front view, and then on the sides view. This is about the energy. Here it is going to show the energy levels of 64 joules of this person, and the balance is 100%. We go to the next chakras. Now, these are the chakras which you are going to see. Now, I mean, you people know much very well than us. I'm just a beginner in this. And these are the chakras, all the 7 chakras which are going to see on this screen. And there are, they have indicated a green band over here. If it is within this limit, obviously, which is a normalcy. If it goes beyond that, yes, it is borderline. And anyway, beyond that, what they have shown it in violet color, definitely there is something like an abnormality. So this is about the chakras. And if you want to see a balanced view, yes, even that option is available. See, these graphical representations are very important to us to convince our patients. That's the main thing, you see and believe. That's the concept in the public here. Therefore, you need to show things and say that, see, this is what is happening to you. But at the same time, we need to clinically correlate and see what is going to happen next. So this is about the chakras. And if it is shifted onto the right side of your screen, then it indicates a different thing. If shifted onto the left, it indicates different things that I will show it later. And coming to the next is the analysis, wherein we are more concerned as psychiatrists. What you see here is the bar, the horizontal bars that is related to stress. Now, many patients who come to us, I'll show you case studies later on, they don't, agree and say that they don't accept that I have got tensions. There's a lot of stigma attached coming to a psychiatrist. They have a lot of stigma. Therefore, I need to tell them, see, you have got stress. And they say, is it seen in me? How can you say that? So that's how we can show our evidence here of this person. Definitely this is a case study, but here you can see that it is in the optimal range. So that's a bar which is indicating here. Next, coming to the next level, it is the energy. So optimal, please remember about homeostasis. The more the energy, the more healthy you are. No, it has to be in a particular bandwidth. That's the norms we follow in any of our parameters, biological parameters, hemoglobin something between 10 to 14 and sugars between 80 to 120. Therefore, on similar lines, 40 to 70 is the optimal range for energy. Anything more than that can indicate inflammation or any cancerous changes. Anything less than that can indicate, a depression or any other problems going elsewhere. Now, this is a balance. What we are seeing here is the third bar. This is a balance between the organs balance. Almost the organs are balanced optimally. Then there is again the organ balance which is shown here. So we come to the next thing is yin and yang, and this is more related to the acupuncturist. I have got very poor knowledge about this. But anyway, these are the energy meridians, and probably any of the you people practicing acupuncture might be very useful because the points are shown here, and then what is less, what is more also are indicated here. For example, the liver in this person is 7.25. It is supposed to be between 4 to 6. The meridians are shown, And after correction through acupuncture, probably the changes also can be seen. Now coming to the other things, what we call it as an area diagram of this person. Now this indicates the energy of this each organ. It is shown across in a global way. Now this is supposed to be, whatever diagram you are seeing, supposed to be within that green bandwidth. Lesser on the pinker side, on the inside very low, and more on the outside it's very high. As I told you, more the energy, probably more the inflammation, less the energy, probably some other disease. It has to be in this particular green zone. There are some peaks, for example, this person on the sacrum, and so this is where it is shown. The energy level is 8.75. That means it is much more higher. It should have been somewhere between 4 to 6. So this is about the area diagram. Then we have the energy diagram. This basically shows about the energy reserve. Now, many times we don't have that capacity or the backup or the compliance or the stability or the sustainability. We call it as a reserve, energy reserve. So of this person, does he have this energy reserve? And that it should be much more than this area diagram. What you see here in a brownish way inside circle, inside diagram is about the energy of the person, and whereas these are the reserves. Then we go to the next level. Then we have this different balance. Several, almost 8 to 10 parameters are available. This is a balance of the different organs. I don't have time, but they just glance through almost 32 organs, which shows the parasympathetic and the parasympathetic in the changes. I think in Ayurveda we have Ida and Pingala. Any imbalance in that in the organs also can be shown here, right? And then we have next we go to another important thing, what is called as an organs energy, right? So here you see on your right screen, boxes are given. If it is 4 to 6, then it shows a green depiction, that's normal. If it's something higher, then it goes towards more of the yellowish, or less it goes towards more of this. That's what you can see here. Urogenital, it's much more higher, 7. So something probably is wrong. Now, before I go ahead, just a simple, I just need to tell here, see, whatever changes we see here in the energy level doesn't indicate that the person always has a recognizable physical illness. Please remember this. There is something called as a predictive medicine. Something related, something like astrology, medical astrology, something called as a predictive medicine, wherein, what the concept here is, first there is a changes at the energy level, then there are changes at the thought at the emotional level, then there are changes at the endocrinal level, then there are changes at the physical level. That we call it as psycho, neuro, endo, immunology, or the physical changes. So the whole thing, starting from the energy changes at the energy matrix and then going on to the physical changes, might take in something around 6 months to 1 year time. That's the concept they have. And so therefore, when we see any changes in a particular person, it means it can meet either ways. Either there is already a physical deformity there, or the person can have a disturbances later on to be recognized physically later on after 6 months to 12 months. So that means to say it is preventive medicine. When I say that, yes, this person, I'll show you some cases that a 35-year-old person coming up with, we'll come to the cases now. We don't have time. Now we have, few cases of, see what I'm showing here is Aditya. One case, see the confidentiality has been hidden here. These are not the true names. Now this person, Aditya, a 25-year-old male coming to us with a panic disorder, right? And he presented with panic, saying that he has got palpitation, breathlessness, the typical panic attacks. But we still had Aditya. He presented with us with typical panic disorder, but we were not sure because we wanted to rule out organicity. So when we took a energy diagram of this person, this is how it looked. What you need to look at here is this particular, where I am showing my pointer on the screen. I think my screen is visible. So you can see that the energy depiction is changed over, it is broken, right? So that's what we see here. And this is related to the coronary vessels. Now, once we start looking at his chakras also, you can see how the chakras are impaired. Probably the heart chakra is definitely deviated. It is a whole of deviation across all the chakras. So then we sent him across for additional studies. Yes, he was sent for ECG and also for a treadmill, even though he was hardly around 25-30 years. There is a strong family history of ischemic heart disease in his family. And even though we are not able to detect totally, but we did suggest him that what changes he has to undergo. And we come to the next case. That means to say this case is depictive Aditya. but the person not giving us the proper history, but we are able to detect it. Okay, next we come to another case by name Teja. Again, he is a case of a 20-year-old female coming up with a case of OCD. Anyway, here the patient did not reveal us much. Then we did an energy scan to him, and we were able to detect, if we're able to see here, this is related to the back where the energy flow is much more. And then when we started asking this particular person, he said that he had a fall earlier and then he continues to have low backache. That means the history is not being given properly because they were unable to remember it, felt that it was not relevant, but we were able to pick it up onto the screen. What you can see here in the full screen that the basal chakra has shifted again. Now we come to the next case by another person, a female coming with, she's 45-year-old and she lost her husband recently for COVID. And she was not, if you can look at this energy pictorial depiction, then it is not so typical what we saw earlier in the first case. A lot of it is broken. Energy level is somewhere around 55, balance is definitely less. She was undergoing a grief reaction where she did have depression, was unable to put it across to us. She was in a denial mode. But once we did the chakras, what you can see here is the heart chakra, which has shifted a lot. And definitely there was a lot of emotionally she was suffering. We were able to diagnose it and then put it across to her into counseling. Now we come to three more slides. I'm going to take another 5 minutes. Now, what are the changes? The second thing is, can we show the objective changes to the patient? Now, we have a patient by name Chidananda who is 45-year-old. Now, I am going to compare and show it here. Okay, I think you are able to see the screen. Now, he is a 45-year-old male coming to us with depression, and on the left of your screen, we have done it on 2nd of July, and this is how his particular energy figure showed. You can see a lot of broken lines over here. Now, after about 21 days of therapies, definitely there is a change in him. Same thing if you are able to look at the chakras. Okay, right. This was his on the left of your screen is before treatment, on the right is after treatment. Okay. Now we go to the next case by name Devamma. And again, she is 45-year-old female who has come to us with menopause symptoms. And definitely it's a case of moderate depression. Next case wherein we are going to show objectively what are the changes. So we have an option here in the software where we can compare the results. So as I'm clicking here on my left side, you can compare here. So this lady, 42-year-old, came to us with depression. And this is what you are seeing here again on the left side before treatment and here on the right side after treatment done after 2 months with holistic treatment. This is our energy diagram. We go to the chakras. Again, you can see these changes over here, right? And the last case which I am going to share. Now, this patient, Mr. M, has again come with lot of acute, what we call it as acute psychotic reaction because it started after a stress. Now, after treatment, definitely it was with our allopathic medications along with nature cure and these sort of things. You can see the changes onto the right and the left. The changes what you are going to see. Then the chakras, which were much more disturbed earlier, and how they got aligned later. So these are the few examples I was trying to show here to depict how we can bring about changes and show the changes in our clinical practice. Now, we started with this objective of, I'm coming back to that objective of enriching our client-centered clinical practice. So this is our short experience we have with Kirlian Photography in our day-to-day practice. But I'll just put across my challenges and then conclude over there. Now, since I am an MBBS graduate with the MD in Psychiatry from Manipal, when I do these sort of studies and then show to my own colleagues, I'm telling about my MBBS colleagues, definitely they do question me, are you practicing pseudoscience? Now, that is one of my biggest challenges, not from the patients, but from my own colleagues. But I do answer them in a different way, saying that when I'm helping my patient and I'm not harming them, There's no problem as far as that. That's one challenge we have. The second challenge is how you put across the language you utilize or the communication, how you put it across to the patients in an understandable way. That's another challenge we have because the clientele we get here is of an urban based, of rural based and semi-urban. So that is another second challenge we have. And then the third challenge we have is like, integrating this data in our day-to-day practice. We have this 20 years experience of practicing integrative mental health. And now the clientele have got confidence in us saying that yes, whatever you do definitely is going to help us. The fourth challenge is the cost part. Since it is something new and then we can't just go on a high price. So we are making it more accessible to the patients. My sincere advice or, my experience is, if we start something which low, we don't go a premium for that, all that investigations, very basic. We charge hardly around 200 to 300 rupees for this whole thing. In some centers, they charge around 1000, 2000 for this viable. But we make it more accessible to treatment and then show them what are the changes. So with these challenges which we have faced and with my short experience, thank you all for your silent hearing. Dr. Jayesh, thank you very much.
Thank you, sir. Thanks a lot. It was really and indeed a new experience to know about psychiatry and energy changes and through BioWell. So we are really grateful to you.